Welcome to SwiftWrite, a writing agency that provides top-quality content writing services for students. Today, we will be discussing the topic, therapy for pediatric clients with mood disorders. Even though young patients live for a short period of time, they may not be immune against major depressive disorder as well as its related complications. Medical practitioners should not neglect the importance of evaluating this condition, properly diagnosing it, and effectively managing it. The authors of Magan, Kalashaw, and Stringaris, 2013, reported that MDD usually occurs at 10 to 17% in the general population when children are younger. Females have an increased prevalence of MDD when compared to males, with the incidence nearly doubling in females. Other scientific research has identified MDD in adolescence as a primary cause of the rise in diseases and fatalities among young people and children in recent years. Additional research has found that depression is more prevalent in adolescence and rises as an individual progresses through the stages of their lives. An African American mom took her 8-year-old son to the emergency room after he complained of sad feelings on many occasions. The patient's instructor has stated that the kid has been isolated from his peers, according to the patient's mother. Mom has noticed a reduction in appetite as well as unpredictable cycles of irritability in her son. He is displaying indications of sadness at this time. The physical assessment of the kid was uneventful, and laboratory test results were within normal ranges. The kid was referred to a nurse for mental assessment and treatment. His mental health examination revealed that he had been awake and centered X3. He was such an excellent historian. The kid stated that he was sad, and that his affect had been dulled, although that he did occasionally grin. He asserts that he did not have auditory or visual hallucinations, and that no paranoid or delusional cognitive processes were identified. It has been noticed that the children have proper awareness, judgment, and comprehension. He denies having any present suicide thoughts, although he has had fantasies about dying in the past. The rating system for children's depression reveals that the child has a result of 30. Translated to major depression. Decision 1. What alternatives were presented? The alternatives include Sertraline 25 mg by mouth on a daily basis, Paxil 10 mg by mouth on a daily basis, as well as Wellbutrin 75 mg by mouth twice on a daily basis. Which of the various choices did you select? Sertraline 25 mg taken orally once a day was my choice. What made you choose that particular option? According to Magellan Health, 2013, research has demonstrated that sertraline would be an effective treatment for depression in children in comparison to placebos in clinical trials. Decision 2. How many alternatives were presented? There were 3 options presented: Prozac 10 mg by mouth on a daily basis, sertraline 37.5 mg by mouth on a daily basis, and sertraline 50 mg by mouth on a daily basis. Which of the following options did you select? I decided to raise the dose of sertraline at 50 mg taken orally once a day. When treating young patients, it is essential to adhere to the highest ethical standards while prescribing medications in every aspect of medical treatment. One such approach is the mandatory reporting process and the manner in which it is communicated to the kid and his or her parents. Before progressing, it is necessary to clarify the various components of the material, including explanations such as expected risks, advantages, and options. Yin et al. 2010, contributed to the topic by stating that children less than 14 years old are often unable to agree to treatment, and that the criteria for the age of such consent vary from different state and country. Thanks for listening. If you need a similar paper done for you, do not hesitate to contact us at swiftwrite.com. We offer 100% plagiarism-free content writing services, with 100% satisfaction guaranteed. Follow and subscribe to our channels on Instagram at swift.write, Facebook at SwiftWrite, LinkedIn at SwiftWrite Services and YouTube at SwiftWrite.